Our first block is called Community is a Practice, Not a Place. Today's conversations are about health and how we age and bridging divides, about what it means to be a neighbor and a citizen and a human being in 2026. About creativity, it's about survival skills. This is going to be about leadership that starts not in Washington, but right here at the local level, in the places where people actually live their lives. And it ends, well, I'll just tell you now, today's going to end with revolutionary love. So, right? We need some of that. If you need to emotionally prepare for that, you have hours to do that. But we are starting this morning in a place that I think is going to surprise you, because when we talk about community, we have to start with the most fundamental question of all. Are we well? Are our bodies, are our minds, our systems of care actually keeping up with what we need? Our first guest this morning has spent his career at the frontier of medicine and technology, asking, how can we not just treat illness, but prevent it? How can we use science to give people more healthy years, more quality of life, more time with the people they love? He is one of the most cited medical researchers in the world, a cardiologist, a scientist, and someone who genuinely believes the breakthroughs happening right now in medicine are going to change what it means to be human. Please welcome to the stage Dr. Eric Topol.
To be with you at this Waves Festival. Let me first ask, is anybody here not interested in extending Healthspan? No? Okay, good. We're in the right place then. All right, so we're going to get into some exciting, new, and really impactful work that's going on right now that's going to change the human health span. And it's this path to super aging, if you will. Last year I published a book called Super Agers, and it was about all the evidence we have, not so much to improve longevity, but to really extend health span. And this patient of mine, Lee Rusal, who lives here in San Diego, who will be 100 very soon, in the next few months, she is a prototype of a super ager because she's entirely intact. She's had no significant diseases, chronic illnesses, and she's a painter. That's one of her oil paintings in the background. Now, what's really interesting about Lee is her family history. That is, her mother died at 59, father 64, brothers at 43 and 75. Now, we studied 1,400 people like Lee Rusal, and we did whole genome sequencing on them, because we thought it was going to be a genomic underpinning. And we found very little evidence for genomics to be the real explanation. And many of the families had this same pattern, where there was no evidence from their lifespan, health span, that there was some commonality in the family. That is very much in contrast to the elderly, as we call them, which is the typical American who has at least one chronic disease by age 65, which essentially means the end of their health span. So this is a big difference in concept. Health span is being alive with no significant chronic illness. And of course, we can keep people alive with artificial life support. That's lifespan, but that's not really meaningful health. So there is this gap. The average American has a health span of 64 and a lifespan of 79. And that difference of 15 years on average is what you could consider sick span. And we need to get rid of that. Okay? That's the goal. And it's very much different from what you're hearing from a lot of longevity companies and all sorts of other things out there. In fact, this was the New York Times Magazine just a week ago, the issue, the longevity issue, and it featured a cellular reprogramming, which works very well in mice to make them rejuvenated. However, they also get tumors because there's a lot of convergence between the hallmarks of aging and that of cancer. So that isn't ready to go into people yet. And that's, of course, what this article is about. And yes, it's overhyped. It may work someday, but it's years off. And so this is in contrast to the big thing we learned, and the theme of what I'm going to be talking about here this morning is that it's our immune system that accounts for this remarkable health span. And during our aging process, our immune system starts to lose its protection. And then it also induces inflammation, or inflammaging, as it's called. These two intertwined processes are central. And we see every aspect of the immune system is affected, particularly T cells, and we can consider this like the aging pacemaker. And it's really striking how this has risen to the real cause of healthy aging. And in fact, other cells, like so-called natural killer NK cells, are very substantially affected. And that's in centenarians with a healthy status. So this process of immunosenescence, inflammaging, that occurs variably. Some people might start having this at age 60 and others at age 90. And it is the key to the major age-related diseases of cancer, neurodegenerative disease, and cardiovascular. So the science of aging has just catapulted, and that's what is really part of the reason why there's so much talk these days about longevity and health span. Because yes, there's these ideas about reversing aging, like the cellular reprogramming and senolytics and stem cells and all sorts of other strategies. But what I think is much more exciting and in the near term and realistic is preventing these age-related diseases. We have many ways to do that, as we're going to get into. So everyone has thought about their age as their chronologic age. That's about to be replaced. It won't be just about your chronologic age. It'll be about your biological age. And it's not about these so-called epigenetic clocks that detect the methylation side chains of your DNA that you can order commercially. Those are not very helpful. But what are helpful are organ clocks. So from a tube of blood, the proteins, plasma proteins, up to 11,000 of them, the key proteins, can be analyzed and then tell us about the age for each of your organs, including your immune system. And this is part of a really extraordinary proteomic revolution. And in fact, one of those companies, Illumina, SomaLogic, is the one that does 11,000 here in San Diego, and then the other is Olink that does 6,000. It's Thermo Fisher. And these two companies and others that are starting are onto this remarkable ability to derive organ clocks. And not only organ clocks, but cellular clocks. So this is moving from what was the whole body clock, if you will, to be able to tell within each person whether there's one thing that lights up as problematic that has accelerated aging. I've already had these clocks done, and they will be available commercially, I'm sure, in the next year or so, and that will be very helpful as part of the routine assessment of patients as they get older. And here's the proof that the immune system is critical, because in the various cohorts now replicated across several studies, it was the youthfulness of the immune system and the brain that were the two critical determinants of not just longevity, but health span. And now we have the cellular clocks to back that up, because now we can do the immune cells, which is remarkable. The proteins from the immune cells picked up through a blood sample. And that, along here, you see the astrocytes, which is a critical cell component of the brain. So we can actually track that in any given person now. We never had this capability before. So immunity and aging, these are really critical aspects of how we're going to keep ourselves and everyone healthy in the years ahead. There's another part to this story, and it relates to a discovery with AI. So the thymus gland was always thought to be basically done over by age 20. so-called involution, that it became fatty and afunctional. Well, after Hugo Ertz and colleagues at Harvard started to look with a AI of the chest CT and found that there were people already well into their 80s that had a fully intact thymus gland, which was a real wake-up call. And now we know we can image the thymus through a CT scan. Again, this will be something that's going to be available routinely in the next couple of years. And we can tell the thymus health score. And this thymus health score is extraordinary because it tells us about the ability to withstand cardiovascular, neurodegenerative disease, and it's correlated with extended survival. In fact, these are striking statistics that we recently reviewed in The Lancet. You don't see very often 50% reductions in mortality or this cardiovascular mortality or in cancer. So the thymus health score is yet another insight that I should say we don't have any way today, here it is in 2026, to assess a person's immune system in the clinic. What a big hole that is when it turns out this is the most important thing that's associated with Healthspan. Now, there are things we know that keep our immune system healthy and help prevent inflammation, untoward inflammation. And those are things like diet and sleep and exercise. We'll talk a little bit about a surprising effect of vaccines. Lack of environmental toxins, which is a big deal, like air pollution and microplastics. And also we have medications that seem to work this very well in addition. We do know that the ability, if you follow a really healthy lifestyle at age 50, that will give 7 to 10 years more of healthy aging compared with people who don't have a particularly diet, exercise, and sleep health. So what does exercise do to help us have such a healthy longevity? And one of the things, of course, is it really gets our immune system primed to be much more functional. And it happens in many different ways. This is a summary from a recent review of that. It's striking, and we didn't anticipate how much exercise primes our immune system to function so well. It also protects our brain. It protects against brain inflammation, and it has just extraordinary impact across the board. It's the one singular feature that has the most potent effect on keeping our immune system healthy. Now, sleep is another thing that we've found to also have a similar effect, and we haven't paid enough attention to sleep health, and this is something that has system-wide, across-the-board effects, particularly keeping our immune system intact. Now, one of the things that people don't do is keep a very regular schedule of sleep. It turns out if it is very regular, that has a big impact not just on neurodegenerative disease, but on cardiovascular and cancer, which is really interesting. And basically, the big thing about sleep that we've learned is that this glymphatic system in the brain washes out like a dishwasher every night, correlated with the extent of deep sleep. And if you don't get enough deep sleep, these toxic metabolites, including beta amyloid and other waste products, accumulate in the brain and induce inflammation. So this has really been a breakthrough of understanding glymphatics. And the diet, I think you know, the Mediterranean diet has been proven in randomized trials, in large cohorts, as the most compelling evidence we have about nutrition. And here is one example of 105,000 people followed for 30 years. And the people that made it to extended health span were the 9% who very diligently followed a Mediterranean, predominantly plant-based diet. Now, I wanted to give you one piece of good news that was unanticipated. For the coffee drinkers, this is a surprise that we didn't know, but coffee is really good for Healthspan, really. Yeah, that doesn't mean you should go out and drink it, but if you are, you should feel better about it. It reduces mortality, cardiovascular mortality, all-cause mortality. It's amazing, and we don't even really know why. We've got lots of theories about that. So those of you who had your coffee this morning, you can feel good about that. Now, let's just talk about how we're going to get rid of these dreaded age-related diseases, because we're going to do that. It's going to take time, but we're going to chip away because we have ways to measure the aging process in cells and organs we never had before. So Alzheimer's is first up. And this is a picture of the amyloid and tau proteins that accumulate in the brain. And if you don't have inflammation to react to these proteins, it's a whole different look. So the immune system is the center stage of Alzheimer's disease, as you might expect. And it turns out that the Shingrix vaccine, the shingles vaccine, and the original one, Zostavax, in 4 huge natural experiments conducted in 4 different countries around the world, had a 20 to 25% reduction of dementia and Alzheimer's disease. Really? Yeah, really. Yeah. Backed into this. No one would ever guess that. It doesn't work through the virus of herpes zoster. What does it do? Well, it revs up the immune system. And these are people generally who are at least age 50. So when I saw this data, I had been reluctant to get a Shingrix vaccine because it has side effects that aren't always so gentle. And I said, this is really important. And if those of you who are over 50, I encourage you to help not just your prevention of shingles, which is not a good thing to have, but also to prevent Alzheimer's. This is the first intervention we've had that has shown substantial, unequivocal reduction of Alzheimer's disease. That tells us we can do something about this, and it tells us about the importance of the immune system. And there's also a question, should we be reducing the age? Different countries have a different age bracket of when, and these are natural experiments. They're better than randomized trials because they're based on a 1-day difference in birth date across these huge studies. So it turns out we know a person's going to have Alzheimer's 20 years ahead of when they will get mild cognitive impairment, the precursor to Alzheimer's. Now, why is that a big deal? Well, if we have 20 years ahead, we've got to be able to do something in that time frame. That's an incredible runway. Now, the big breakthrough in this field is a blood test, a biomarker called p-tau217. The tau protein, the site 217. This has been available for a couple of years. How many people have heard of p-tau217? Oh, okay, that's pretty good. Better than usual. It was an informed group. This test tells us about a person's risk years before. In fact, a paper was just again published yesterday replicating this. And if we have a person's age and their p-tau level, we can say when they're going to develop mild cognitive impairment. That's how extraordinary this test is. So we have this is a study that was presented here in San Diego a year ago, where they did a small study of intervention of lifestyle intensive, and then they had a control group where they didn't try to push that, and the people in the intervention group had a remarkable reduction of p-tau217 and other neuromarkers. The point is it can be improved, which would put off the potential for Alzheimer's disease. So we are following up with that, as I'll mention, in a randomized trial starting in the next couple of weeks. So the other things we're not doing are using our images. AI can interpret images with superhuman eyes that radiologists, dermatologists, pathologists, cardiologists can't see these things. And it's pretty extraordinary. And so every image that we get, we are leaving things on the table that AI can interpret that we can't. It's really quite remarkable. So the retina is yet another window into our body. And we should be getting retina AI every time you get an eye exam, and we're not. But the retina tells us about developing Parkinson's disease, or Alzheimer's disease 5 to 7 years before there are any symptoms. And across many other, whether it's cardiovascular, whether it's liver disease, kidney disease, it's remarkable how much is encoded in the retina that AI can detect that we can't, and we're not using it. And you'll see that change, and you may even be doing selfies with your smartphone of your retina in the future. So the trial we're doing with Alzheimer's incorporates these really exciting new evidence for prevention. This is a prevention trial. We're taking 1,200 people who have very high risk. They have ApoE4, they have carriers or 2 copies, they have a family history, they have a polygenic risk score, and they have a high p-tau level, and they're 60 years of age or older. And those 1,200 people are randomized to 24/7 coaching on lifestyle or just getting some educational materials. And we'll see how much we can drop p-tau and how much sleep, exercise, and diet and the whole lifestyle changes change the fate of these patients, of these participants. Now, we can change the fate of cancer as well, because it turns out most people think a person develops cancer, it got started recently. Wrong. It's been taking years to develop. And these are some examples of an 18-year-old where we now have single-cell sequencing. We can track the evolution of cancer. And that person had cancer at age 48, but the precancerous mutations were present when she was 18. Here's a 53-year-old where the precancerous mutations were present at 16.7 years, and so on. So we can get ahead of cancer, which we have not done, and we should be doing, and we will be doing in the future. And one of the reasons why this cancer gets a chance to proliferate and spread is because the immune system of that person is down. It's lost some of its critical protection. And so now we have this ability to track evolution of cancer and get onto this whole new field of what's called promolytics. That is, to take on the precursors to cancer, the promoter mutations. And this is going to be part of the future with a blood test to find these promoter mutations. Now, to give you an example of how we're not doing what we should be doing, are mammograms. Every mammogram should have 3 different AI components. And it's incredible. The largest study of AI in medicine, over 100,000 women in Sweden, showed that the AI with the radiologist, compared to 2 radiologists, the AI radiologist combo was far superior, picking up 30% more breast cancer. And we have another AI that picks up, with a normal mammogram, the likelihood of cancer high risk in the next 3 to 5 years. And we have another AI that picks up the heart disease risk of the breast artery calcification as good as we can pick up any risk of heart disease. And we're not using these things. And it's really sad, because this is proven, the best evidence, and we're talking about preventing cancer and preventing heart disease with a mammogram. So we got to get on this. And what about preventing pancreatic cancer, one of the most dreaded cancers? We have the Mayo Clinic study that picked up pancreatic cancer 3 years before it was diagnosed through AI of the CT scans. So we can prevent a lot of cancer with some of the things we're talking about, particularly when we find the people whose immune system is impaired and have a genetic predisposition or some other reason to be at high risk for cancer. Last, cardiovascular. The cardiovascular story is getting rebooted. All these years, we just paid attention to tight narrowings or blockages. That's changing. Now we can get to the basis of that, which is inflammation of arteries. So for one, we don't do polygenic risk scores. Everybody should know their polygenic risk scores for heart disease and cancers and others, but we don't do them. We should be doing them. The data is extraordinary. This is a simple, inexpensive test that you find all the different variants in your genes that are giving you a particular increase or no risk. Here you see we can pick up heart disease risks from this. It's the best polygenic risk score that we have, largely not being used. We've published recently about how we can pick up the people who are at risk for heart disease exquisitely now. And then we have the ability to use simple markers like LDL, C-reactive protein, Lp(a), which we'll have a drug for very soon, and be able to get all over this and prevent inflammation. But the big thing is we couldn't see inflammation before of the arteries, and now we can. And so here is a study from the UK. They had 40,000 people consecutive where they did CT angiography, and they used AI of the artery wall, the epicardial part, to pick up the exact level of inflammation. And people who had even just one inflamed artery with no narrowing, just inflammation, had a 13-fold higher risk of heart disease. No less 3 arteries, 30-fold risk of heart disease. This changes everything for heart disease. So now we have these GLP-1 drugs, these wonder drugs that no one expected would have these benefits across the board, well beyond weight loss. And we are seeing weight-independent effects for the heart, the liver, the kidney, and even osteoarthritis and psoriatic arthritis. Who would have guessed this? It's because these drugs have a potent effect on inflammation, not just in the body, but also in the brain. And they also improve our immune system response. Even it's been posed, should these be longevity or Healthspan drugs in the future? I don't know, but at least something that's going to be pursued. And in fact, our next trial in Alzheimer's will be with a GLP-1 drug once we ice the story about the lifestyle factors. The last thing I want to leave you with is this if-when story. In medicine, we could only say if you're at high risk. Well, let's say you were at high risk for Alzheimer's disease because you had ApoE4, maybe even 2 copies. We couldn't tell you if the risk was age 66 or 99, which makes a big difference, right? But now we can say when. That's the biggest difference about being able to predict. When you can have the when part, then you can have a person actually take things seriously because you can change that when, right? Instead of it being 3 years, it could be 10 years. And so that's really the big difference. Why can we do that now? Who would have expected this? This is work from Morris Gerstung from Germany and colleagues throughout Europe. And they were as shocked as I spoke with Morris about this finding. So you know large language models are about tokens. You tokenize words or pixels, right? This is about tokenizing health data. So instead of LLMs, it's LHMs, large health models. And here's the first one that came out last September. Now there's 4 more. It predicted 20 years ahead for 1,200 diseases. We've never had anything like this, folks. So you could say asthma at this age, pancreatic cancer at this age, heart attack at this age. That's something that has never been seen before in medicine. And it's not, this was with GPT-2, which has a very rudimentary model with 2 million parameters. We have models with 1 trillion plus parameters, and that's what's going to be used to do this in the future, and it's being explored currently. And when you add more data like polygenic risk score, it gets even better than it is just with electronic records. And by the way, that was done in 2 million people from Denmark and 400,000 people from the UK Biobank. We're not talking about a small study. This was just published, it's a preprint from colleagues in Mass General Brigham. They did the same thing with 7 million patients in the Mass General Brigham with tokenizing their health data, predicting 95 important diseases when in the next 5 years. So there's a lot of these models. It's going to change in medicine. It's going to help us predict people's risk and prevent diseases in the future. It's what I call full stack medicine. The more data you have on each person, the more you'll have an accurate arc of their health over the years ahead. This is a real turning point in medicine, something we've never been able to do before. And it was enabled by AI. So a lot of people, there's a backlash against AI. I wouldn't have that if you're interested in your health, because a lot of good things are coming out from it. So just to sum up, in 2026, today, what does a primary care doctor do for prevention? Well, they tell you to get the shots, they get a lipid panel, some blood work, and if they have time, they might even talk about healthy behavior. That's it, folks. That's preventive medicine today. What's it going to be like in the future? People will have their polygenic risk scores, maybe even their genome sequence. It's very low cost now. They're going to have this prediction for the next many, many years of what to be on the lookout for. Organ and cell clocks, the immune system clock, maybe a thymus score, biomarkers like p-tau217 and many others. They'll have their labs interrogated by these models, because doctors miss things because they're not out of the normal range. But in fact, they could be a very important trend. The same for the images that we're not processing properly. So there's so much excitement here. And what I just end up with is, today, most things that are being done for drug discovery are for treatments. The future is for medicines that prevent. I call them PrevMeds. So I've been trying to get these drug companies to change their whole system to come up with preventive medicines, because we know we'll see more treatments, but they're very rare cures. What we want to do is prevent these darn diseases so we don't have to have the treatments, and that's the goal. So I'll just leave you with, I'm here with Lee Russell. I'm hoping there will be a lot more people like her in the years ahead, and just want to acknowledge sources we have for our funding. And thanks so much for your attention, and best for a long health span.
With Dr. Topol, when we talk about inventing the future here in San Diego, we forget that we're doing that on so many different fronts. And when you think about extending human lifespan or extending our health span, that's a pretty fundamental way in which we're affecting the future. And I'm just tremendously excited about that work. It blows my mind every time I talk to him.